Well, good afternoon, folks, and I hope I can add on the comments of my colleagues here. The title of my session is Keeping Producers and Ag Workers and Their Families Safe During This Time. So let's just quickly begin. What I want to do with you for the short amount of time I have with you is just to remind you about the NIOSH Ag Centers and who they are and how they're distributed throughout the United States and how they could serve as a resource for you. Thinking about the challenges for our rural communities, and then how do we prepare for this upcoming wave that we're kind of already in, and then talk a little bit about some mental health resources, and then maybe just a quick overview of some of the questions that I've been getting.
First, I'd like to just give you for a second because you're
sure.
You can click on that red arrow, and because it's kind of covering part of your slides, that red arrow where you see the control panel for the presentation.
Okay, let's see, red arrow.
Yeah, so right up where that control panel is, that has like, oh, there you go. You can go back to your PowerPoint presentation.
Okay.
Click on that. There you go. And then do you see where there's like the dialogue where you have your controls, like your volume and your, up at the top, there's a little red arrow.
Oh, it's actually on my screen here.
There you go. Now it's gone. Yep, you're good. You're perfect.
Okay. All right. Sorry about that.
Sure.
All right. Just a quick overview of the National Institute for Occupational Safety and Health Ag Centers. They're designed to really minimize the burden of occupational disease and injury in agriculture workers and their families. And we do that through kind of some research, prevention, education, and communication. And unfortunately, we have a real-time situation where we're needing to apply those issues. Just to give you I need to go back to my screen here, bear with me. These centers are actually located throughout the United States. So I just highlight here, for those of you that are in different parts of the country, these are resource centers that you can tap into, and hopefully they can actually provide some local resources for you, because it reflects the fact that we have forestry, fishing, and farming in different parts of our country. So I just want to just give a shout out to those different individual centers and the activities they're doing. Specifically, our particular center is located in the upper Midwest, and we have a number of partnerships with our schools of public health, our veterinary school, our Department of Health, and also the National Farm Medicine Center in Marshall, Wisconsin. Also, because we do work with Hispanic workers and migrant workers, we work with Migrant Clinicians Network based out of Maryland. As Dr. Fowler pointed out, we also approach these complex, wicked problems with a One Health approach. And so we really have a goal to really look at health outcomes both for people, animals, and the environment. And we do that through actually thinking about how do we communicate together, coordinate together, and collaborate together. And so when I think specifically about this issue and my concern about our rural communities, there's a number of things that really come to mind. One is that many of our folks that work in our rural environments feel safe because they already feel like they're isolated and thinking, this isn't going to come to me. Also, our rural populations are older. On average, our farmer in the States is about 58 years of age. And another issue that we're really experiencing in our rural communities is that we have limited healthcare access, or that it's not readily available, or we know that many of our rural hospitals are closing. We also have this feeling of invincibility. You know, I'll be fine. And then the other thing is we don't have really redundancy in our workforce. We have a limited workforce. So if somebody gets sick, then we really do have limited folks that actually can pick up the work and take us to the carry on if we're not available to do the work. So some things about how should we prepare. And so one is that we really do want to raise the awareness. I really appreciate our organizers and sponsors for, hey, this is a big deal, and really raising the awareness and really signaling the fact that it's coming. The other thing that we need to do is we need to engage our employees, talking to them, listening to their concerns, thinking about how do we best plan for this impact. And then that is next to setting up a plan. How do we do this? And then lastly, you know, we need to lead well. We need to be good examples for our employees, for the people we work for our communities, and how we can respond to this. So one of the things that I just want to just give some general recommendations for employees is, on many farms, be it livestock operations or other agriculture operations, is that we need to practice good biosecurity. And we've been talking about this for a number of decades now. But part of that is to limit farm access and also limit activities to really essential activities. We don't want people on our farms who shouldn't be on our farms. The other thing that I really want to emphasize is what Dr. Fowler mentioned, is if we're sick, we need to stay home, even if we have mild symptoms. As was pointed out too, that asymptomatic folks may, or folks with mild symptoms may transmit this virus. The other is just to wash our hands frequently and to use hand sanitizer if we can't wash our hands frequently. And then disinfect commonly touched objects like phones and computer keyboards or doorknobs in our work environment. So this is actually some material that actually our Swine Disease Eradication Center actually put together and sent out to folks. The other thing is that people will say, well, why don't I just wear a mask all the time? And really, one of the things I want to just remind folks is that, remember, personal protective equipment should be our last resort. We should be looking for other ways to make sure that we're not allowing that bug to come. In other words, if you're sick, please don't come to work. Is there ways that we can kind of administratively or engineering-wise, through hand washing and work policies, prevent that, and only use personal protective equipment for those who really need it? And in this case, it really is necessary for those that are in the healthcare industry, those nurses, those doctors that are actually seeing patients who really do need to work and use those personal protective equipment. So just a quick reminder on this hierarchy of controls. The other thing just to really emphasize is the issue of social distancing. We've heard a lot about this, but what does it look like on a farm? One of the ways that we can think about this is maybe we can do early morning huddles and divide tasks and hear about potential problems by video conferencing, or maintaining kind of some social distance or 6 feet apart. Can we change our work schedules to limit the number of people that are coming in or stagger when they're coming in? Is there ways that we can kind of segregate individual areas and use cell phones or video conference to really communicate if we need to communicate? Also, when we think about the break room, can we limit the number of people that might be in the break room? Maybe 2 people at a time in a break room are just some practical examples, and you may have to think of others depending upon your individual situation. The other thing I just want to take a notice is that, we're a week into this now, this large experiment, if you will, of practicing social distancing, dealing with the pandemic here in the United States. But we need to think about frankly, the stress and the anxiety that we're going through, recognizing it not only in ourselves, but also in our neighbors and our friends. So one is just to be aware of the signs and symptoms of stress, the importance of checking in on our neighbors, even if it be Facebook or other mechanisms, and really encourage regular social interaction and support, either through our local churches or virtual coffee visits. Again, thinking about the mental resiliency and mental health of our rural communities. And that brings me to another point that I just want to remind us, is that we need to work and respond in a community. And so this involves kind of more of a team environment, thinking about, well, who can we engage in the process to really get us through this difficult time? Is it our educators? Is it our community leaders? Is it our extension service? How do we support our healthcare providers? Are there veterinarians that actually can serve as resources in that regard? Or are there ag educators that might be somebody in our rural community that can actually help us with that? Again, one of the basic reminders that we need to reinforce is the importance of hand hygiene and hand washing. So wash your hands, avoid touching your face, which is hard to do. Stay at home if you're sick, even if you think it's just a cold, and then practice that social distancing. And there are some resources out there on how to do that. The other item that I've been getting some questions with as well, and Dr. Fowler has brought up, is also we need to protect the animals. At this point, livestock or other animals have not been shown to transmit this virus to us, but we want to really limit the potential for transmission. Remember, as Dr. Roy pointed out, that this virus originated likely through bats, through an intermediate host, and is now well adapted to people. Again, if you're sick, stay at home, and then also avoid contact with your livestock or contact with your pets, or limit that so that we don't transfer to them as well. So just to start to finish up, these are some of the questions that I know that I've been getting a lot of. It's, what if one of my becomes ill with COVID-19? What do I do? How long can this survive on surfaces, and how can I disinfect it? And both these questions have been somewhat answered from our previous two speakers. What does social distancing look like in our workplace? And I gave you some examples of that, and again, it might be dependent upon your specific situation. Another question, shouldn't we all be wearing N95 masks? And the answer is no. We need to reserve those for our healthcare providers. And then lastly, what's the role of pets in transmission? Again, we haven't seen transmission from our pets to us, but we do worry that we could give it to our pets. So if you're sick, please take some precautions to limit your contact with your pets. So in summary, we need to just raise this awareness, especially in our rural communities. We need to really create plans to support producers, workers, and their families. And then we need to kind of be aware and prepare some precautions. And then lastly, I just want to encourage folks to engage their communities there. There is some general information on our UMASH website, also even on the mental health resiliency piece, and then also for hand washing. We do have one video that we did in conjunction with the National Pork Board on how to protect animals with influenza. Some of these same concepts can apply with COVID as well. We just don't want to give these diseases back to our animal populations. And with that, I'm going to turn this back to our moderators.